Acid reflux, or GERD, is no joke. It is a common condition that affects millions of people around the world. We have all had that burning sensation in our chest that catches us off guard, leaving us reaching for antacids like there's no tomorrow. But here's the thing. Did you know popping pills and medications isn't the only way to relieve yourself from acid reflux? Today, we are going to explore the underlying causes of acid reflux and heartburn and discuss effective methods to alleviate the pain and discomfort associated with them. Contrary to popular belief, the burning sensation in the chest after a meal or certain foods is not primarily caused by excessive stomach acid. To put it in simple terms, acid reflux happens when the stomach acid gets back up into the esophagus. We all know the stomach produces acid to help break down food. These stomach acids are a mixture of hydrochloric acid, enzymes, and mucus. Hydrochloric acid, or HCl, is what breaks down food in our stomach so it can be digested. This acid is so strong that it can have a pH as low as 1.5 to 3.0. If you don't know how strong that is, well, to put it in perspective, that's stronger than the acidity of lemon juice, and we all know how sour it tastes. However, there is a ring-like muscle called the lower esophageal sphincter, or LES, that usually keeps these acids contained in our stomach. It is a muscular valve located at the junction of the esophagus and the stomach, and its primary function is to prevent the backflow of stomach acids into the esophagus. This muscle ring usually closes after food passes into the stomach, preventing stomach acid from backing up into the esophagus. But the LES can sometimes relax or weaken, allowing the stomach acids to back up into the esophagus. And when that happens, you start experiencing symptoms such as heartburn in your chest, which is the most common symptom people with acid reflux experience. You can also experience other symptoms such as a sour taste in your mouth, coughing, and others. In approximately 90% of cases, the malfunctioning of the LES is what causes low stomach acid, also known as hypochlorhydria. Sufficient levels of stomach acid are necessary to signal the closure of the lower esophageal sphincter. Unfortunately, stomach acid levels tend to decrease with age, poor nutrition, and stress. Research has revealed that around 35% of individuals over the age of 55 have low acid secretion due to atrophic gastritis, a chronic inflammation of the stomach lining. If hypochlorhydria or low stomach acid is left untreated and heartburn occurs more than twice a week, it can progress to gastroesophageal reflux disease, or GERD, which may result in serious complications such as scarring, ulceration, and even esophageal cancer. GERD is a prevalent condition, affecting approximately 20% of the people in the United States. Symptoms of acid reflux and GERD include the taste of regurgitated acid, dark stools, nausea, vomiting, severe cramping, difficulty swallowing, a sore throat, a dry cough, bloating, and pain while lying down. To tackle acid reflux at its core, it is crucial to understand why low stomach acid leads to its development. As we have previously discussed, acid reflux is usually caused by low stomach acid, not excess. This may seem illogical, as increasing stomach acid would seem like the logical thing to make the problem worse. However, low stomach acid can make it difficult to digest food properly, which can lead to food particles backing up into the esophagus and cause heartburn. Now you may ask yourself, what causes low stomach acid? Low stomach acid, also known as hypochlorhydria, can be caused by several factors, such as aging, chronic stress, poor diet, and certain medical conditions such as gastritis, autoimmune disorders, or H. pylori infection, which can cause inflammation or damage to the stomach lining, causing the stomach acid to be low. Luckily for you, one proven way to significantly increase your stomach acid and reduce the risk of your getting acid reflux or GERD is by taking betaine hydrochloride HCl. Betaine hydrochloride is a compound that contains hydrochloric acid, which is a natural stomach acid. Betaine hydrochloride cannot naturally be found in specific foods, as it is an acidic form of betaine. When the stomach does not provide enough hydrochloric acid, food is not broken down properly. This can lead to fermentation and gas production. The gas can push stomach acids up into the esophagus, causing heartburn. Betaine hydrochloride is a compound that can help increase stomach acid production and improve it, which can help relieve the symptoms of acid reflux. It is a safe and effective supplement for most people. However, it is important to start with a low dose and increase gradually as needed. Apple cider vinegar contains enzymes and acids that can help balance the pH levels in the stomach, preparing you to be able to take HCl. To use apple cider vinegar for acid reflux, mix 1 to 2 tablespoons of the vinegar with a glass of water and drink it before meals. It is advised that you take at least 2 tablespoons of apple cider vinegar, or ACV, before taking HCl. This would help stimulate your stomach lining and acid production in your stomach. If after taking ACV you don't experience any form of gastric burn, then you are ready to take 1 to 2 tablets of HCl with a meal. This can significantly reduce bloating and discomfort after eating. However, betaine hydrochloride should not be taken by people with ulcers, gastritis, or other stomach conditions, as it can interact with certain medications. So it is important to talk to your doctor before taking it. While medications like antacids and PPIs provide temporary relief, alleviating symptoms of acid reflux, these medications can have side effects such as osteoporosis, bacterial infections, and damage to the kidneys and liver. However, natural remedies focus on addressing the underlying causes. And luckily for you, we came up with these natural remedies that have been proven to help you take care of them for good. So stick till the end to find out what the #1 pick is. If you are enjoying this video so far, then click on the subscribe button so you don't miss others like it. Starting off at the top of our list is making lifestyle adjustments and changes. How so? There are a few lifestyle changes that can be made to help stop acid reflux naturally. We are not asking that you change up your whole life just like that, but certain lifestyle changes go a long way in combating acid reflux. Here are a few of them. Maintaining a healthy weight. Excessive or obese weights put pressure on your abdomen, increasing the risk of acid reflux as more fluid is pushed upward into your esophagus because of excessive body fat. Shedding a few pounds can help reduce the risk of constantly having to deal with acid reflux. To manage your weight, just eat a balanced diet and exercise regularly, and you will notice the significant improvement it will bring to your overall health. Watching your diet. I know we have heard "watch your diet" multiple times before now, but in this case, certain foods can trigger acid reflux. Common triggers like spicy and fatty foods, citrus fruits, tomatoes, onions, chocolate, coffee, and carbonated beverages can trigger acid reflux. Instead, eat lean proteins, whole grains, fruits, and vegetables. Next up, we have eat smaller meals, but more often. Large meals can put pressure on the lower esophageal sphincter, LES, the muscle that keeps stomach acid from flowing back up. To help prevent acid reflux, eat smaller meals more often throughout the day. Avoid eating close to bedtime. Lying down shortly after eating a meal can worsen acid reflux symptoms. To help prevent acid reflux, it is medically advisable to wait at least 2 to 3 hours after eating before lying down or going to bed. Quit smoking. Smoking also contributes its fair share to how people end up with GERD or acid reflux. Nicotine in tobacco causes the LES to relax or malfunction, and when this happens, the acids in our stomachs always flow back up into our esophagus. So if you are a smoker and you are looking to reduce the risk of getting acid reflux disease or GERD, you should quit smoking. Don't wear tight clothing around your stomach. Tight dresses can put pressure on your stomach and make acid reflux worse. Elevating the head of your bed. Raising the head of your bed by a few inches can help prevent stomach acid from flowing back into the esophagus while you sleep. To do this, you can use your wedge pillow or place books under the head of your bed. It is advisable to elevate the head of your bed by a few inches. Trying any of these would significantly help reduce how often you get acid reflux. Moving to the next natural remedy, we have natural herbs and roots. Herbal remedies have been used for centuries to treat a variety of health conditions, including acid reflux. Some herbs that have been shown to be significantly effective in relieving acid reflux symptoms are ginger. Ginger has anti-inflammatory properties that can help reduce inflammation in the esophagus and stomach. You can add it to food when cooking, drink ginger tea, or take ginger supplements. Marshmallow root. Marshmallow root creates a soothing film on the lining of the esophagus, which can help relieve acid reflux symptoms. It can be found in supplement form or taken as marshmallow root tea. Chamomile. Chamomile is known for its calming properties because it contains a particular compound called melatonin. which has been shown to have antioxidant and anti-inflammatory properties that can help protect the gastrointestinal tract from damage. It has also been shown to help soothe acid reflux symptoms. A cup of chamomile tea can be enjoyed before bed or as needed throughout the day. Coming in at number 1 on our list of remedies is finding effective stress and anxiety reduction techniques. Stress and anxiety can cause acid reflux symptoms. Stress causes the stomach muscles to tighten up. When we are stressed or anxious, our body responds by releasing a stress hormone known as cortisol that prepares us to either fight or flee the perceived danger. This hormone can have a number of effects on our digestive systems, like causing acid reflux. To manage acid reflux caused by stress, it is important to find ways to relax and de-stress. That can be done through activities such as meditation, yoga, or spending time doing hobbies that you enjoy. Taking care of your mental well-being can help improve your overall health and well-being, including your digestive health. We have come to the end of this video, but remember that it is always advisable to seek the advice of a medical expert before using any new treatments, especially if you have any pre-existing health issues or are currently taking medication. We trust that this video will help you make healthier decisions from now on. If you enjoyed watching this video, hit the like button and share your thoughts and experiences with acid reflux in the comments section below. To enjoy more helpful videos like this, don't forget to subscribe to this channel, and feel free to check out other videos from us like the one showing on your screen right now. Until next time, stay reflux-free and healthy. We will catch you in the next video.